We lived in what can only be called a hippie commune. We were the original hippies, but we were the serious hippies.
Keep your head up high. Rest your...
So Leslie, my wife, I picked her up hitchhiking. And that's a short version. So Leslie and this other girl were by the side of the road, and my bus picked them up.
We got on that bus, and there was Darryl.
My friend Nicholas and I, we both looked at each other with, hey, this is cool. And, and we're driving along, and pretty soon the two of them are singing in harmony. And I said, oh, come on, we got a couple of angels here. And we married them. We went looking for a place to buy a farm, and we found a place in Tennessee. We bought it, moved into the woods, made a life. And we ultimately ended up doing our own medical care, deliver our own babies, our own schools, publish our own books, invented stuff. We were all a bunch of city slickers, and we did it.
But you can't spread your wings.
I went into the dentist for a tooth cleaning. Tooth cleaning. They did an x-ray. They saw that this is a 3-rooted tooth. Only one was completely in bone. There was a tooth that's not there, the last tooth. That uncorked the genie. They found cancer there when they pulled that tooth out.
This is a stage 4 tumor. It's deeply invading the bone. It deeply invades the skull base.
Well, one of the first things that Dr. Mansfield established was that we're not, no longer trying to deal with a tooth here. We are trying to save your life.
Untreated, Darryl wouldn't survive more than several months to a year. The cancer has grown and eaten away all of these holes in the bone. We have to remove this entire segment in one piece.
When Dr. Mansfield actually showed us with how much they're going to take this and this out, we were both like...
They're going to be carving out huge chunks of my skull and stuff. And he comes up with this little gizmo that corks it all and makes it normal. Even if I were to go into a decline now, it'd be hard to bitch. I've really had a great life.
There will be a combination of treatments. In this case, surgery initially, followed by radiation therapy with chemotherapy.
2 thumbs up, we'll see you inside.
As a result, we'll have a much higher success rate in curing the cancer than simply with surgery alone.
You're the king. We're taking care of you. Everybody in that room is there to take care of you. You tell us what we need to do, okay? While that's happening, blood pressure cuff, cardiogram leads, pulse oximeter on your finger. None of this will hurt. And I'm going to give you some very special medicines in your IV. Whoosh, off to sleep.
Okay.
Next thing you know, awake, finished. I will be with you every second. Okay. Relax, if you can. You let me worry for you.
At 69, I've been playing goalie for things like strokes and heart attacks. And then broadsided by this cancer, it just really never occurred to me.
You're just going along, living your life, and suddenly, new movie.
Last time I'll have this much of a smile.
Keep your head up high. Rest your mind at ease. Don't let nothing get you down.
Lights off, let's go green. Here's a very nice view of the tumor. You can see a bulge here, and this is a tip of the iceberg where that's just the beginning of the tumor. Prepare the saw.
I will actually use a saw to make an incision through the cheekbone, into the nose, across the cheek, and into the skull base.
We're very close to delivering this. Look at how that fractures out. Just beautiful. The tumor's out.
Excellent.
So what we're doing now is we're taking samples of the peripheral margins for biopsy.
These tumors could have already spread, and that's a reality that we all have to live with, that we go through this entire process And sometimes down the road, we find that there really was something small, we just couldn't see it.
And there's where the tumor was located. Now there is a large hole. If we don't fix that, everything he eats goes out his nose. All right, let's get the obturator ready. So there's the obturator fitted. That's just lovely. Beautiful fit. All done. Went great. Let me give you a big hug.
Oh my gosh.
Yeah, he's great. He's fine.
This is the first time you're seeing him after all this,
Yeah. You made it.
Yeah.
You look like you look going in. You're still handsome.
2 thumbs up. 2 thumbs up.
This is the worst, and you're surviving it.
Okay. Give that a try. It's got to snap in. You got to feel it. There you go. Feel that snap?
Yeah.
Okay.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Thank God we build those obturators, though.
Good grief. I'd be a monster.
Okay, so why don't we chat a little bit about the pathology results?
Yeah.
Come on, sit over here with your wife if you don't mind, so we can face both of you together. So, one of the most important parts of the surgery is to decide what type of cancer we were dealing with, how the cancer is behaving. And today I have really difficult news about the cancer itself. And one of the most important questions I need to ask you as I go through this with you is that it really is a decision whether you want to have the cameras in the background or whether you want to talk privately first.
Privately first.
Okay.
It was bad. A biopsy of the cells was much more aggressive. They're in the prime of life, kicking butt, mine.
With the operation, you feel like you've come through something really big, and you want it to be done, and then you realize, oh, it's still here, you know?
Doesn't change the treatment, doesn't require further surgery. Chemo and radiation were inevitable in any case.
Your drip is about 1/3 done already. What we're going to do is clear any residual microscopic cancer that might be there.
Okay, you ready to start?
I'm not afraid of dying. The problem with my dying would be the impact on the people left behind, not on me. I think my wife would be upset for a while, but she has a dog.
You just want to appreciate and love what you have and get on with it, not waste any more time, you know, being bummed, and, you know, just get on and love our life.
I'm in good spirits because your attitude is optional. You choose it.
You did awesome.
Look at the resources being expended on this. I'm 69.
That was your first one.
You know, I feel obligated to do something worthwhile. This ain't free time from here on.
So first and foremost, you're finally finished your radiation therapy. Quite a journey.
Yeah.
So where we stand right now is that we don't feel at this point that further treatment is necessary.
Boy, do I ever like hearing that.
So what I'm really sharing with you today is that you are cancer-free. We have been able to effect an early cure for your cancer.
You guys did it.
Wow. Didn't expect this.
Thank you for getting me through all this.
Just a bump in the road.